Our speaker today is Robbi Nathan, and she's with the Lincoln Care Consultants for the Aging and has been manager for over 10 years. She has over 30 years in the healthcare world, from billing to scheduling to home health. Robbi works with elders and their families to remain at home safely and comfortably. She assists in navigating care between other health providers and facilities. She is not the first and not the last to say that there are a million stories and so many lessons to be learned from our elders. She is married to a retired Navy man, has 3 sons, and is a native Nebraskan. Today she will share the Care Consultants Elder Care Handbook, a resource used by professionals and created for everyone who cares for another. And right now I'd like to have Robbi come up.
Thank you. I also have these handbooks, since we're going to be talking about these handbooks. So I'm going to ask you to take one and pass it down, and if you're a couple, if you could share. As Carol said, I'm Robbi Nathan, and I'm the Lincoln Branch Manager for Care Consultants for the Aging, which is a home health service here in Lincoln. We have what we call our mothership is in Omaha, and then we also have a branch in Des Moines, Iowa. Care Consultants started in 1991, So we've been helping elders and their families for over 20 years. We came to Lincoln in 1998, and in 2008, when the economy went, we opened up an office in Des Moines. We thought, why not? But even though we are usually helping people in their homes remain there safely, independently, wherever they call home, we also have another mission, and that is to educate the public as to the choices that they have nowadays. And it always amazes me how many people don't think they're caregivers. So I'd like to ask you, how many of you think you're caregivers? If you'd raise your hand. Those of you who do not, do you ever check on your neighbor to see if they take in the paper? Or do you ever call your mom or dad once a week to see how they're doing?
No.
You're a caregiver. You're a caregiver if you're doing things as simple as that. Even taking somebody to church services on a Sunday. That makes you a caregiver. The 2 ladies who started Care Consultants for the Aging both took care of their mother-in-laws in their home, and both of their mother-in-laws had Alzheimer's. And literally the only break they got was when their husbands came home for lunch. So they'd go for a walk and they'd start asking each other, what do you do about this? And where do you think I should go for that? And all of a sudden it dawned on them, we can't be the only 2 people in Omaha who are asking these questions. So they put together a resource handbook, like the Elder Care Resource Handbook here. And in 1992, Omaha's first handbook, which is almost kept under glass and you have to go through a security check because there's only one left that we know of. It was 20 pages long. In 2012, the Omaha handbook was 240 pages. So if you think things haven't changed, they've changed. This is the 7th edition of the Lincoln Handbook, and the 5th one that I've been blessed to work on. It actually takes about 9 months, so I tell everybody that I will start my pregnancy soon. We will be giving birth to the 8th handbook in June or July. We publish every other year. I'd like you to kind of navigate through this. We're really proud of it. We have excellent caregivers who fill just about every spot in this, and that's my 2-minute infomercial. It's divided into 5 chapters because there are really several chapters when you're taking care of someone. The first one is at the back of the book, and that's your first chapter in life. If you realize you're going to take care of somebody, you need to have the legal means to take care of somebody. You have to have those papers in line and easily accessible. You're going to find your lawyers and your legal representatives in that last chapter, and believe me, the next edition, this really will be the first chapter. But it gives definitions of durable power of attorney, healthcare power of attorney, a living will, all of those things that you need to have. That gives permission. Okay, I have permission to take care of my mom. Do I have the money to take care of my mom? Does my mom have financial needs to be taken care of? You're going to find financial advisors in the back. You have an excellent financial advisor, long-term care insurance representative here in Connie, who will help navigate through that. She's going to make sure my mom's money lasts and that it's spent well and her health needs will be addressed by her coverage. So you'll find people in there. You'll also find charts on Medicare, and I have to apologize because our book comes out every other year, so the statistics that are in there for Medicare are from 2011. They haven't changed a whole lot, but they've changed. There's also the requirements for Medicaid. If somebody wants to spend down, or if they think they already qualify for Medicaid, that's in there. There's an excellent resource, Aging Partners, that takes up a good part of that. And they will give you free advice also. Okay, so I'm taking care of Mom. When is the ball going to start rolling? Probably with a medical event or crisis. I'd say about 80% of the clients that we help in Lincoln, we first meet them when they're in a crisis. They're in the hospital, they've fallen, all of a sudden they can't remember to turn the oven off. Or they open the front door and off they go and they can't remember how to get back home. So what are you going to do? In the first chapter you'll see geriatric evaluation. And that's where a family can go with their loved one and say, you know, there's 6 of us kids, we all want the best for Mom, but there's 6 different best ways. What should we do? So look up the geriatric evaluations. Brian West does an excellent one here in Lincoln. There are a few in Omaha. Unfortunately, Lincoln does not have a geriatric specialist. Hopefully by the next issue they will. But these are experts who are going to look at the medication list. They're going to look at the home setting, the physical, mental capabilities of this person, and they're going to tell the family one of several things. And I'm always going to use my mother as an example because she always uses me as an example. So they're going to say, your mom needs to be in either a nursing home or assisted living. Your mom can stay at home or be in independent living, but she's going to need a little extra help. Or they're going to say your mom's just fine. What are you worried about? But at least you've got that medical opinion. You're also going to find in here, and I can't touch everything, but I'll touch most of it. You're going to find your hospitals. You're going to find therapists who will come to the home. If they don't come to the home, we don't list them in here. But you'll have your physical therapists, respiratory therapists, speech therapists, etc. You're also going to find the pharmacies that offer home delivery. Here's a little tip. If you're going over and you're thinking, oh my gosh, I have to line up Dad's bags of medications tonight. There are pharmacies that will do that and they won't charge. There are pharmacies that will deliver to the home and they won't charge. Usually you have to get your medications from those pharmacies, and more often than not, they don't have to be prescribed medications. They can also be your vitamins. I know one pharmacy, the minimum is 5. So I take a vitamin B, a fish oil, a calcium, B12, and because I have 3 boys, I take a blood pressure pill. That's 5 medications there. I can have them package it up and deliver it to me. And they'll even remind me when I'm due to have that prescription renewed. So that's something you can take advantage of. There is also transportation in here. Think about it. If you have a wheelchair or a walker, do you really think that little Toyota from Yellow Cab is going to be able to transport you? Probably not. And that person who's driving that cab may not be covered by the type of insurance that allows him to help that person get in and out of the cab. So here you have a little lady with her little rhinestone cane sitting in her wheelchair, and up drives the Toyota. Well, he's going to have to make a choice. It's either the wheelchair or the lady, or she's going to have to call somebody else. So we categorized it in the back. We have transportation. It starts being listed towards the back of that chapter on page 19. The first part is wheelchair transportation. These people have the ability to transport somebody who has an extra piece of equipment. And then there's non-emergency ambulance transportation. Those are the people that are coming home from the hospital, or maybe somebody's being transferred from one place to another. There's air transportation, so if you have the money and want to live on the edge and fly back and forth to your appointments, these are the people that you would call. Right. There's also general transportation, and you can call all of those people. At the end on 22 is financial assistance, because there is financial assistance out there. People just need to reach out and call them. Also, in this chapter, you're going to find your hospice care providers, and I will tell you right now, Lincoln has several hospices, and no matter who you choose, it's an excellent choice. They are all just wonderful. There's also, as you move on into the second chapter, okay, my mom's coming home from the hospital, and the discharge planner is telling me, your mom's going to need some help at home. Who do you think you're going to get in? Well, of course, I'm going to say call Care Consultants for the Aging, because I'm biased. But there is somebody for everybody in Lincoln. We've divided it up because it can get quite confusing. As I said, most of our clients have to make this decision when they're in a crisis. Make it easy on yourself and your neighbor. Go through here, talk to these companies, look at their websites. We all love to talk about what we do, how we do it, and how we'll make life better. When you're listening to me, can you imagine having 6 of me in the same room talking about helping you? You can make that choice and know that when you need that person, you're going to be able to pick up the phone and confidently choose the right business. Some things you need to think of are, what am I going to need? Will I need a companion? Because companions cannot do what we call hands-on care. They're wonderful. They can make sure you're safe, that your home is clean, you get where you're supposed to get, and that you're tucked in. But they cannot do hands-on, which is where they actually do services that require the use of hands on the client, such as bathing, toileting, dressing. So you want to remember those things. Or do you think a certified nurse's aide or a nurse will be needed? These are the people who can do hands-on care, and they can help remind you and take your medications. Nurses can do management, and they usually work under doctor's orders, but they do things such as change dressings, all of that. How much a part of these cares do you want to be? How much do I want to have, and does my mom want to have when somebody's taking care of them? Care Consultants for the Aging is client-directed care, so the clients and their families manage the cares, and they tell us what to do, how to do it, and where to do it. Because we're client-directed care, we can do some extra things, such as actually administer medication and do transfers over 25 pounds. Otherwise, they're going to have to do it under a nurse's or a doctor's direction. How much are you going to need this help? What days, what times, how long? That's something to think about. Will I be allowed to cut back on hours or increase in hours as needed? Will I need a doctor's order to do that? If a person's coming home under Medicare, they're going to need a doctor's order. And also, who's paying for this? Remember that first chapter? We need to know who is going to pay for it. Is it going to be insurance? Are they coming home under Medicare? Is it private pay, or is it another government program? I will tell you, if somebody comes home under Medicare and they want more care, they can hire privately. You can do that because it's not a duplication of services. So you can use your long-term care insurance and Medicare at the same time. Just do the road work and study it. In here we list places by whether they're registry, which Care Consultant says, or if they're non-medical or medical. So you want to look at those and think, again, what do I need? How long will I need it? Who's going to pay for it? In here also are emergency response systems, the little alarms, the bracelets and the necklaces. I will tell you, those are great. They're a lifesaver. But think of a few things. First of all, will the person who's wearing that remember to press it and how to press it? And I have to tell you a story about one of my favorite little ladies. She was what we call a thumper. And she would always go like this. Oh my, it's hot outside. Oh goodness, I could use a glass of tea. She lived in an assisted living facility, or independent living facility, and she had those people running every 20 minutes. Oh my, oh gracious. So finally they convinced her that she'd be better off with a bracelet. And everybody's a lot happier. So you want to think about those things too. There's home health equipment in here. Many times you're going to need that home health equipment. Again, any place you go in Lincoln is great. They will work with you. If they don't carry the equipment, they know who does, and they'll get it for you. If it's not covered by your insurance, they've got ways to figure out how it can get covered by your insurance, or they have a comparable item that your insurance would cover. I have a disabled husband, and he needs one of those canes with a little seat on it because we're going on a trip. And I just picked up the phone and called, and they go, oh, I know exactly what you want and what color you want it. So we're taken care of. And I mean, it's just that way for everybody, not just because I'm who I am. There's also loaned home health equipment. You've got a brother-in-law coming out from California, and he needs a transfer bench for the shower. Now really, are you going to go out and buy your brother-in-law's shower bench just because he's going to be here for a week? And I'm sure that that's not something that he can carry on the plane when he comes out. So call up one of these places, say, I have a need, can I borrow? And they will say, yes. And they have it all safety inspected up to standards. It's clean, doesn't cost you a penny. Your brother-in-law loves you and thinks you're the smartest thing on earth. And all is well, and you just return it when you're done. There are places listed in this chapter that will help build the ramps. They'll help make kitchen cabinets and bathroom counters more accessible to the disabled and those who have wheelchairs. They'll widen your doors. They will do anything and everything to help you be safe. And in there too, under home safety, on page 42, is what they call Safe Homes for Seniors, and it's grant funded, and it's a wonderful program. It costs nothing. All you have to do to qualify is be over 60 years of age. They will come out, they will look over your house, and see if there's any dangerous chemicals or hazards, and if they need to be put in different containers or stored differently, or if they need to be hauled away, and they'll haul it away, and it costs nothing. Hundreds of accidents have been prevented because the people have reached out and used safe homes for seniors. Okay, my mom's been at home. It's not working. She's going to need some more care. So I'm going to have to go to the next option, next chapter, which is living options. You can literally eat your way across Lincoln when you're looking at facilities. You can go in, say, I'd like to take a tour, I'd like to sit down. They'll say, oh, come on over for prime rib lunch. So you get to talk to the people who live there, see what they like, what they don't like, and believe me, they will tell you, they will be honest and upfront about it. The apple crisp on Fridays stinks. So you need to find out what these facilities offer. We have an explanation in this book on what independent living is, also what assisted living is, and skilled nursing. Independent living, we're not seeing a huge increase in that because we're getting more neighborhoods that are geared towards the older adult. But we are seeing a lot of independent livings that are beginning to build on, and they will grow into assisted livings, and even down the line they'll have skilled nursing attached. We have a few communities already like that, such as Gateway Senior Living and Eastmont, where you can go in independently, and then as you age, you can age in place with your neighbors, which is really nice. The page that describes assisted living across from page 50 gives you some hints, some questions to think about. And get out that legal pad and a sharp pencil and write down your questions and start interviewing. Because if you have seen one assisted living in Lincoln, you've seen one assisted living. They're all different. Do they have transportation? Can you bring your pet? Do they have a beauty shop? Do they have religious services? Can you bring in outside help? How long can you stay in assisted living? At what point can you no longer stay there? What are their extra charges? Are they going to charge you if the nurse has to bring the medicine to your room? Are they going to charge you for more than 2 baths a week? Are they going to charge you for doing your laundry? And if they do, are they going to charge you by the wet load or the dry load? Those are all questions you need to ask. My question, since I'm taking care of my mother, is do you have a free ice cream machine and a popcorn machine? So, you know, there's something that's important to everyone. And you want to make sure that you or that person that you're placing is comfortable there. You're also going to move on in here, and you're going to see one of the fastest growing chapters in communities in Lincoln, and that's the assisted living facility specializing in Alzheimer's and dementia. Waterford just opened their new memory care unit down by Wilderness Ridge last week. They have 24 beds. Gateway Senior Living is expanding, and they'll have a memory unit next year. There's one that's being built on the corner of 84th and Old Cheney, and it has over 60 beds. Lincoln is a great place to be if you can't remember where you are. And people in the medical field have an awfully macabre sense of humor, so forgive me if I'm offensive. But you just really have to look at those things. You know, there's going to be different levels of Alzheimer's and dementia. Quite a few of our clients have dementia or Alzheimer's. Some of them are very sweet. Some of them are very physically active. Some of them just are just a hoot. That's all I can say. I had one little lady who would call me up every day. She's gone now, bless her heart. She would call me up every day, and she would chew me up one side and down the other. It got to where I put her on speakerphone because she wouldn't let me say anything. And I just go, yes, yes. And then she'd go, so that's the way it is, and she'd hang up. And I'd look at that phone and I'd say, have a nice day, Phyllis. And she would call me every day about 10 o'clock. I knew that was her. People with dementia and Alzheimer's are really close to my heart. I have a soft spot for them and for the people on hospice. That's where the stories are. But moving on, there's also skilled nursing and rehab. When I was a kid, if somebody went to a nursing home, that was the end of the line. It's not that way anymore. The average stay in a nursing home is 6 to 8 weeks, and the average age in Nebraska is in your 50s. Because we're seeing, with the progress of medicine, we're seeing more people recover from motor vehicle accidents, boating accidents, and brain injuries too. So it's not the end of the line anymore. You're going to have more one-on-one staff, you're going to have more one-on-one care, and you're going to have more specialized medicine in the nursing homes. But you better have good insurance too. At the end of this chapter, on page, let's see, is also your assisted living, or excuse me, your HUD, your public housing. And those are very good communities. Lincoln has some well-tended ones, some well-cared-for ones. Moving on, my mom is in an assisted living, and in the 4th chapter, I'm going to find some of those extras that Mom would like to have. The senior services chapter is the miscellaneous section of the cookbook. And you're going to find in here adult day services, and those are all different. Medicare pays for some of them. Insurance is paid for some of them. A lot of them are private pay. And I'm going to chop my nose off and spite my face. It's a very economical way to help care for a loved one. It is more affordable than in-home care. The person is with people that are of their skill level, of their need level. They feel important. I have a client who volunteers at her adult daycare every time she goes. And it's great because she knows she's helping the community and she feels like she has work. And her husband can take care of the business and can meet with his friends, and they come home at night and they share their stories. When looking for an adult daycare service, you want to ask a lot of questions too. Does the person have to be continent? Do they have to be verbal? Can they ambulate by themselves? Everybody's different. Also, is there transportation? Because some people are going to need transportation to get there and back. You're going to find in here also your senior centers, your health and wellness programs, because as everyone ages, you need to keep on exercising. And these are the places that hone in on the exercises that won't kill you as you get older. They're more at our speed. We'll see you again. Thank you. There's also driving concerns. Worst job in the world is to take away somebody's keys and not let them drive. Let somebody else get the blame. Here you go, right here. It also gives you where you can get your handicap stickers and the handicap license plates. There's errands and shopping. If that's all someone needs is somebody to run their errands for them, go for it. It keeps them safe and it keeps them happy. There's food and nutrition in here. Meals on Wheels isn't the only place that delivers meals. There are other places that deliver meals. Give them a call. Caregiver resources, your support groups are in here, and there's really nothing better than having a support group. Someplace you can go with your concerns, where you can share your problems and your triumphs. we're lucky enough at Care Consultants that we've just brought on Donna Washburn, who I brought along today, and she was responsible for the caregiver program with Aging Partners. And now she's helping us with caregivers and their families. So you might see her out in the community too. There are some excellent volunteer opportunities in there. Why not? We save millions and millions of dollars every year with volunteers in Nebraska. Towards the end of that chapter, you're going to find the elder moving. Now remember, I was trying to find a place for my mom. Well, on page 98, 99, I was close. On 99, we have a new section called Lifestyle Transition Consultants, and these are people who will help elders move, help sell their home, help finish all the paperwork, and one of them, Bridge for Better Living, will actually take families around and show them all the different facilities and what's in their realm of needs and financial. And they do it for nothing for the client. They're paid by the place that they choose. So that's something to think of also. There's also at the end of this chapter, there's a final chapter in everybody's life, funeral arranging. There's nothing that can compare to leaving your family without all the responsibilities of finding a final resting place. My mother has her funeral prearranged. All we kids need to do is show up. She has her songs picked, everything. And we dearly love her, and again, all 6 of us would have 6 different ways to take care of her. But she is going to go out in style, and we know that Mom is getting what she wanted. My New Year's resolution this year was to pre-plan my funeral, and it was a hoot. I enjoyed it. My girlfriend and I went to Omaha, and I couldn't figure out what songs I was going to have, so we sang funeral songs all the way to Omaha and back. And I'm set. And it was a really good feeling. So think about it. It's something that you can give to your family. What I'm going to challenge you to do is take time in your busy days and nights to kind of look through this book, this Elder Care Resource Handbook. And remember, it is available online also. You can click on the Lincoln Resource Handbook and see all of this without the little ads. Look through this handbook, talk to the people, see what you think of them, because I could have 4 of them standing here and not all of you are going to choose me. All 4 of us will have somebody that chooses us. Put a star by the ones you like, cross off the ones that you're not comfortable with, and then you won't, when you do have that crisis, you won't have another crisis trying to choose how to be taken care of. I really enjoyed visiting with all of you here today. I do want to tell you that this book isn't free. It's $6 if you come into the office. We published 2,000 of them last year. It's $6 if you come into the office. It's $9 if we mail it to you. And if you have to sit and listen to me for 15 or 20 minutes, it's yours. So you have paid your dues. And I thank you very, very much. If you have any questions or concerns, please give us a call. I passed out some sheets that tell what Care Consultants does, and I look forward to visiting.